dorsi, which is the biggest, the strongest. It extends over the infero-lateral surface of the back, and you can see even the thoracolumbar fascia, where from originates in fact the latissimus dorsi. We have also the origin of erector spinae and so on. This thoracodorsal fascia, you have to mention about it when you'll discuss about the obliquus internus and transverse muscle, because both of them presents, except the anterior aponeurosis, a posterior aponeurosis that takes part to the forming of this thoracolumbar fascia. Now, in the upper part, there is a triangular muscle which is named the trapezius, and the trapezius. Do you have gloves? Now, please remove the blanket. Okay. Now, the trapezius extends from the occipital bone to the all over the cervical vertebrae, till the last thoracic vertebra. Finally, it is inserted, on the clavicle, on the spine, on the spine of the scapula, and on the acromion. Now, if we remove the latissimus dorsi, below it, we can see the serratus posterior inferior, yeah, which originates from the ninth rib. No, the origin is somewhere else.
It's from the vertebral column.
From the vertebrae, yeah. Exactly, and it is the insertion is on the ribs, external surface,
9 to 12.
Now, in the upper part, below the trapezius muscle, we can see the rhomboideus, yeah, rhomboid muscles, which are two: minor superior, major inferior. And below these muscles, there is serratus posterior superior. You can see its fibers very clear here. But I don't like the position. Now, below the serratus posterior superior, below the serratus posterior inferior, we can see the third layer, which is represented by the erector spinae muscle, which has an origin in that lumbar mass, and it presents three types of fibers: lateral, medial, and median. The lateral fibers is the iliocostal muscle, the median fibers are the longissimus, and more medial, the spinalis. Okay. Now, let's continue at the level of the upper and lateral side. We can see the deltoid muscle very clear. We can feel here the lateral medial border of the scapula. Imagine that it's in abduction, the upper limb. That's why the position is not normal. So this is the medial border with the attachment of the rhomboideus minor. We have the inferior angle. Don't forget that some fibers from the latissimus dorsi are attached here. We can see the posterior border of the spine with the attachment of the deltoid on the inferior lip, of the trapezius on the superior lip. We can see the infraspinatus muscle and both of the teres muscles. Teres major, teres minor. Very clear. Yeah. Now on the end, what is this? Latissimus. Yeah. Like this. What else is very clear? The serratus anterior, from the anterior surface near the medial border. Now the posterior surface of the arm consists of only one muscle, triceps brachialis, with the long head, lateral head, medial head. At the level of the forearm, we have several muscles, but the majority of them, in fact all of them, are extensors and supinators. Yeah? Now I cannot see, but I can feel the brachioradialis below it. Extensor carpi radialis longus, extensor carpi radialis brevis. Now, you tell me the attachment, the origin of the brachioradialis.
Brachioradialis from about 2/3 of the lateral supracondylar ridge.
And the insertion?
Insertion in the radial side of the
Styloid process.
Base of the styloidian process. You tell me, the extensor carpi radialis longus.
Extensor from the third below these 2/3 and inserts on the base of the second
metacarpal. And extensor carpi radialis brevis. Who knows?
From the lateral epicondyle.
To?
The third.
Base of the third metacarpal bone. Yeah, so they are in order. The base of the styloidian process, base of the second metacarpal bone, base of the third metacarpal bone. Okay. Now, in rest, this in fact are the lateral surface of the forearm. The proper posterior surface consists of, the biggest one is the extensor digitorum muscle, which consists of four tendons. The tendons are going to each finger, but at the level of the metacarpal phalangeal joint, they present an extension that is attached on the proximal phalanga. Now, from this level, this extensor digitorum joins with the lombrical muscles, with the dorsal palmar muscles, dorsal carpal muscles, forming finally 3 types of tendons. Yeah? The medial tendon is attached on the medial phalanga, and the 2 lateral tendons are joining together above it to be attached on the distal phalanga. So this extensor digitorum has a difficult trajectory. It joins, you saw, with the lombrical and interosseous muscles. What else do we have? What's this?
Extensor digiti minimi.
I don't think so. This one. Extensor carpi ulnaris. Yeah? Extensor carpi ulnaris is close to the flexor carpi ulnaris. It's on the base here. Yeah? Extensor digiti minimi, extensor digitorum, extensor indicis, yeah? And here, above the tendons of the extensor carpi radialis longus, extensor carpi radialis brevis, we have the tendons of abductor pollicis longus, extensor pollicis brevis, extensor pollicis longus, where is it? Abductor pollicis longus, extensor pollicis brevis, and extensor pollicis longus. Yeah, this is the trajectory. Do I have to repeat once again? No. Yeah? No. So, okay, we can see the fibers of the extensor digitorum, extensor digiti minimi, extensor carpi ulnaris, abductor pollicis longus, extensor pollicis brevis, extensor pollicis longus, and extensor indicis. Yeah? And on this side, you can see, if you clean here, you can see the dorsal interosseous muscles, which are 4. Don't forget that the palmar are just 3. Now you have enough time to clean these dorsal interosseous. Let's see how they are attached on the metacarpal bones, yeah, and on the proximal phalanga. Okay, this is